everybody, I'm Dr. Nick Circolone. I'm so excited to be here. I always enjoy hanging out with you guys. Today we're going to be talking about the cervical spine. But in the next weeks to come, we're going to be talking about how the cervical spine is implicated in other conditions. So don't forget to subscribe, hit that notification button so you can get those videos as soon as they come out. For those of you who don't know, I'm a board certified chiropractic orthopedist. And what that means is I am the liaison between the medical profession and the chiropractic profession. I see patients that are in between. They don't know where to go, what they should do. Should I have surgery? Should I do less invasive things? And I'm the doctor that they see, and we treat them and see if we can get them better without surgeries. Now, does that mean I'm against surgery? Of course not. What that means is we try to get patients not to have surgery when it's not necessary. So today, what we're going to do is we're going to go through the anatomy of the cervical spine. And in time, what we'll do is we'll refresh and go over some of this anatomy again as we go over the symptoms that are associated with it. The first thing we're going to talk about is what you see here is this is the occiput. This is the bottom of the skull. And the first vertebra we have is called the atlas. The reason why they call it the atlas is because Atlas, the Greek god, held up the world. And that's what this does. This holds up the skull and it rocks back and forth like this and slides forward like this. Then you have the axis. Well, that's the vertebra that the atlas pivots on. Now, here's an interesting tidbit. On the first and second vertebra, the atlas and the axis, that's C1 and C2, 50% of rotation occurs at these two vertebrae. The rest of the 50% occur at the last vertebrae. 3, 4, 5, 6, and 7. As you can see here, the vertebrae are stacked up on top of each other. What they do is they create a foramen right in this area. And in this foramen is a nerve, an artery, and a vein, lymph tissue. There's also ligaments, tendons, all that squeezed into this little tiny area. Still amazes me how God created us. In this area, if we have any problems, it's going to cause all kinds of symptoms. So like I said, stay tuned because we're going to be talking about those symptoms in the next few videos. As we go down here, we have these discs right here. Now these discs are interesting because what happens is if we have any compression of a nerve up here or into the canal, we're going to have different types of symptoms as well. But what's interesting about this is kind of another tidbit. What's interesting about this is when we have cervical surgery, let's say we have to have someone, their disc has to be removed. They go through the neck to pull the disc out, where in the low back, we have to go from the back to the front. Going this way, we have less chance of affecting the cord. When we go through the lumbar spine, we have more chance of affecting the cord because we have to go around the cord to remove the disc. So with that, most cervical surgeries do better than the lumbar surgeries because there's less of a chance of it affecting the cord. That's just a little personal information. I've seen lots and lots of patients that have done really, really well with lumbar surgery and really, really well with cervical surgery, and vice versa. People have done really bad with cervical surgery and people have done really, really bad with lumbar surgery. That is just from my experience that I see that the cervical surgery seems to do somewhat better. Also, we have these spinous processes right here. These spinous processes, we have ligaments that attach to these, and then we have these facets where we have ligaments attaching to there. We also have muscles that go across there. There's tissue and fat and all kinds of anatomy. Now, if you look closely, you'll see this little red line through here. This is called the vertebral artery. And I want to talk about this for a quick second. A lot of times when you hear about manipulation of the cervical spine, you hear about a vertebral dissection. Well, let me tell you something. Research has shown it is extremely, extremely, extremely rare. Does it happen? Absolutely. So you have to be careful, and it's one of those things when you come see a chiropractor, physical therapist, you're going to be told that there's a possibility that we can cause a stroke due to a vertebral dissection. I would not shy away from being manipulated because of that, because it's very rare. but you do have to find a doctor that is not super aggressive, so that way the chances of that happening are even less. As we're going through this, you can see where some of this anatomy can be affected just from the cervical spine. In the next weeks, I'm going to talk about several things that can be caused by this. Everything from radicular pain with numbness and tingling to vertigo. And we'll talk more about that. So don't forget to subscribe, to like, and hit that notification button. I love you. We'll see you next week.